Now, as the COVID-19 pandemic continues to dominate resources, many other diseases have taken a back seat, so to speak. That includes HIV and TB, which are both very prevalent in this country. The South African National AIDS Council has secured a massive new deal that will be used to support and expand the HIV and TB response. The new Global Fund grant is valued at nearly 9 billion rand over the next 3 years. Sanac CEO Dr. Thembisile Xulu joins us now live from Johannesburg for more. Doctor, thanks for your time. We appreciate it. I know that you have been load shed, unfortunately, but we are able to continue with this. So if we lose you, we'll understand why. This sounds like a lot of money to people. Tell us exactly how it's going to be used.
So thank you so much, Shahan, and good evening to your viewers. So normally Global Fund would work through a process where there is a country board called the Country Coordinating Mechanism, which essentially selects principal recipients who then identify the implementers at community level, because at community level is where the rubber hits the ground. So this amount that has been given through us is being distributed through 4 principal recipients, including the National Department of Health, AFSA, NACOSA, as well as an organization called BZ. What tends to happen is that the CCM has got complete oversight, and the Global Fund then identifies through a process that we had as Sanac in terms of national consultations for the country to define what are the country's priorities as per the National Strategic Plan. We put those in the application, and we were pleased that the Grant Applications Committee actually approved the $546 million that you've just mentioned for the next 3 years. And this is used essentially to support the achievements of the National Strategic Plan for HIV, TB, and STIs in South Africa.
How much of a setback was COVID-19 in how we actually handled and treated HIV in South Africa?
I think the setback was huge, Shahan, especially in terms of what we refer to as the second 90, because I think most of us are aware that when we speak about how we measure performance in terms of HIV programs, we look at the 90-90-90, first 90 being testing summarily, second 90 being treatment, and third 90 being viral suppression. So second 90 suffered greatly, with people being afraid to come through to facilities based on the fear of contracting COVID. So we had the second 90 come down to just around 69%. But with the back to care campaigns, which we've implemented together with the catch-up plans, I'm glad to say that the December data that we actually reported to the plenary is that the country is back at around 77%. So with the help of our development partners and together with the efforts led by the department, we have managed to reach our patients in terms of differentiated service delivery models, like delivering medications to communities through programs where using community halls or shopping malls or allowing patients to access treatment at commercial pharmacies, we were able to then get patients back onto care and to give them alternative ways of accessing treatment.
Yeah. And of course, these are both very deadly diseases, let's be honest, if it's not managed properly. So over the past 2 years, were you able to say how many people died because they didn't get the proper treatments, given that resources were moved and attention was moved to the COVID-19 pandemic?
All right, I think we are still at a stage where, from a strategic information perspective, we are collecting data. What we still know is that TB remains the #1 cause mortality for people that are HIV infected. And the TB program is one that definitely took a back seat based on COVID-19. The truth of the matter is that TB is still with us. And what we found, for instance, if you look at provinces like KwaZulu-Natal, where it wasn't just the impact of COVID-19, after that were the service delivery protests, the looting, and now the floods. And what that tends to cause is that it's not just inability of people to access health services because the clinics are closed, but the roads are not accessible, which means that even the data collection and the ability to collect data does become impacted. So at this moment, I wouldn't be able to give you exact figures, except to say what we do still know is that the TB program did take a setback, and that it continues to be the #1 cause of mortality in HIV-infected patients. Hence, if you look at the support in terms of the TB program from the Global Fund, as well as from the Ministry of Health in terms of the TB recovery plan, we have seen a significant investment in order to try to make sure that we don't lose much of the gains that we have had in terms of our implementation of TB and HIV programs.
Yeah. Talk to me about the prevention efforts moving forward, because we can't simply put condoms in toilets and public spaces and expect this to help with preventative measures. There's also technology in place in terms of pills, one called PrEP, which is a preventative measure for HIV infection. And then the US has adopted an injection that actually is used instead of PrEP. What are your efforts in that regard in terms of preventative measures?
All right, so preventative measures, I think, as you've just mentioned, we've got the barrier methods as well as the medical methods, which one of the key ones that has just been approved by SAPRA is what we call the dapivirine ring. And I think I want to mention this one first, Shahan, because it's one of the first ones that's leading us to female-controlled methods in terms of HIV prevention, where a female is able to insert a ring around the cervix in order to make sure that it releases antiretroviral therapy that makes sure that during an encounter, she would not get infected, but does not necessarily need the permission of a partner. The expansion of pre-exposure prophylaxis is correct, but at this moment, our biggest success in terms of prevention is treatment itself, because what happens when somebody is on treatment is that if they are compliant and they become virally suppressed, they then are unable to transmit the virus onto their sexual partner, even when they don't use condoms. Not to say that we encourage utilizing condoms, because we want to use condoms to prevent STIs, pregnancy, etc. But when you get to a stage where you are undetectable, it then becomes untransmittable, and that on its own is also a prevention method. On top of the barrier methods which you were describing, and expanding not just the male condom, but also the female condom. So there is a range of prevention tools that the country is looking at, and the most exciting ones as of late would, for instance, be the dapivirine ring. And as you say, the US has adopted the long-acting cabotegravir. We are also excited at that potential coming through and being adopted in South Africa. And all it requires is that our regulatory authorities then look through the data and approve that, and we start using that because the science speaks for itself.
All right. Thank you so much for your time. We appreciate it. Dr. Thembisile Xulu, Sanac CEO.